Hello, my name is Carly Kitko. I am the primary investigator for this DNP project for Maryville University. The project is assessing healthcare professional caregiver stress by utilizing the Modified Caregiver Strain Index tool and providing mindfulness resources. The committee members for this project are the chairperson, Dr. Holly Jastak. This is for the Catherine McCulley School of Nursing through Maryville University. The second reader is the Professor for Nursing 707, which is Dr. Snell. And the community person is Kelsey Golish, who is the RN Clinical Director at the project site. As for the background and significance for the project, healthcare professional, and I also refer to that as HCP, HCP caregivers provide care in an unpredictable home setting with limited resources and collaboration. Depending on the situation, the HCP has tasks such as bathing, lifting, feeding, administering medications, and this can lead to certain chronic effects such as neck pain, headaches, chronic discomfort, and fatigue. Caregivers experience stress at higher risk for depression, anxiety, and sleep disturbances. They are also at increased risk for heart disease, hyperlipidemia, hypertension, obesity, immune disorders, and also insulin resistance. Increased stress can encourage negative coping mechanisms. This can eventually lead to increased costs of healthcare, missed shifts, and financial strain for the HCP. HCP burnout in the caregiver role can lead to poor patient satisfaction, miscommunication, and increased risk for medication errors. Reducing HCP caregiver stress can reduce those medication errors and increase caregiver alertness and improve patient care. The goal of this DNP project was to bring more awareness of caregiver stress and to determine if mindfulness resources over 8 weeks reduce that stress, which can then improve patient care and outcomes. So I kind of wanted to discuss a little bit of what mindfulness is. Mindfulness is the awareness of one's surroundings. It's learning to observe thoughts, emotions, being in the present moment, and also without judgment or reacting to the moment. Mindfulness practices are efficient and flexible. It can be completed in virtual any setting and also requires only as little as 5 minutes of the participant's time. There are many benefits of using mindfulness to reduce HCP caregiver stress in the home care setting. It can encourage career longevity, which contributes to workforce stability and correlates with improved patient outcomes. It provides emotional resilience, enabling the caregiver to cope with the demands of a high acuity patient environment. This will also help mitigate job burnout, reduce absenteeism, and stabilize workforce capacity. It will provide continuity of care for the patient. There are different examples or techniques you can do to practice mindfulness. These can include deep breathing and paying attention to your breaths, body scan meditation, mindful eating, also mindful movement such as yoga or stretching. Various methods of mindfulness were given in this DNP project, and this included video links, a step-by-step printable document, or a free downloadable phone app. There was a detailed literature review completed for this DNP project, looking at stress in HCPs, interventions to reduce that stress, and the impact and positive outcomes of reducing HCP stress. Healthcare workers in the home care setting experience caregiver stress and burnout, leading to negative physical, emotional, and mental health effects. It was found that the level of burnout is related to the nurse's emotional well-being and quality of life. When burnout occurs due to these factors, there is an increase in errors, putting the patients at risk. Mindfulness therapy is becoming an effective, evidence-based intervention for reducing stress, improving overall well-being, and it is used as a long-term method of stress reduction to improve self-compassion, compassion satisfaction, mindfulness, and resilience. Watson and colleagues found that mindfulness is shown to be a protective factor against stress burnout while providing skills to better manage their stress, which in turn improves patient care and outcomes. The benefits of mindfulness allowed the HCP to better cope with their workload, connect with patients, be more present with their patients, and also become more efficient in daily tasks. This intervention provided the HCPs with the skills to cope with heavy workload, resulting in increased productivity and effectiveness. HCP burnout in a caregiver role can lead to poor patient satisfaction, miscommunication, and increased risk for medication errors. The HCPs who were less stressed had an improved sense of well-being and were able to engage and provide the patients with the best quality of care. Caring for oneself with positive coping mechanisms can improve emotional resilience to prepare the HCP for high-stress working environments, leading to an improved delivery of care. The Plan, Do, Study Act, the PDSA model, was used for the theoretical underpinning of this DMP project. The PDSA is a 4-step process to improve quality of care in various fields such as healthcare, production, education, and also developed with a structural framework to implement improvement changes. The planned stage would be identifying the problem, which in this DMP project is caregiver stress and burnout, impacting patient care and outcomes. The do stage is implementing and monitoring progress, which would be implementing mindfulness resources over 8 weeks. The study stage, collecting and comparing data, making conclusions, which would be taking the Modified Caregiver Strength Index tool scores and comparing them pre versus post implementation to see if stress was reduced. At the ACT stage, you can make changes based on what you found and also modify the plan as needed. The PDSA uses a data-driven approach that enriches changes that are systemically tested to reduce risks and enhance effectiveness to influence a culture of continuous improvement and achieve long-term success. As for the methods and design of this project, the project utilized a quantitative research design, examining the Modified Caregiver Strength Index tool scores, which I will be referring to as the MCSI scores, looking at pre and post implementation of mindfulness resources. The scores were measured before mindfulness resources to get the baseline score, and then post scores were measured to determine if mindfulness resources improved stress. I, as a private investigator, work closely with the clinical director of the project site to send project announcements, the MCSI tool, and recruit for the project via email. Together, we agreed that a score of 4 or higher would be an appropriate score to indicate caregiver stress and burden for the project, and those who completed the tool with that score of 4 or more were sent the mindfulness practices and instructed to use them at least 3 times a week for 5 to 10 minutes in the 8-week time frame. Pre and post MCSI scores were entered into a Word data sheet. These were de-identified with random numbers. To further ensure confidentiality, all data was stored on a password-protected computer, only accessible by the private investigator, me, and the informed consent and MCSI tool were also stored separately on flash drives. Communication between the participants and I were done through my Maryville University secure email, which uses a 2-factor authentication. There was a total of 3 flash drives used for the project, only accessible by me and stored separately and securely. After data is stored for 3 years, per Maryville University IRB requirements, Institutional Review Board requirements, I will be deleting the data after 3 years with the assistance of the IT department. I thought it would be helpful for a visualization of the project design, so I added the project implementation timeline diagram here. As you can see, it shows the steps and the dates of the project. It began with the planning, and then Maryville IRB approval, and then that is when I started with the education at the project site, and then mindfulness resources were implemented over 8 weeks. Finally, as you see, data analysis was completed. I also wanted to include details regarding the MCSI tool. So this tool does not require permission and it is available online to access. It is a 13-question tool with a validity of 0.9 and a reliability of 0.88. As I discussed previously for this DMP project, a score of 4 or more indicated increased need for resources for caregiver stress. Questions on the tool include topics such as sleep, feeling overwhelmed, demands of time, and also physical and emotional strain. The sample for the project. All participants were between the ages of 18 to 65. All HCP caregivers are certified as a registered nurse, licensed practical nurse, certified nursing assistant, home health aide, or direct care worker by the state. HCP demographics include Asian, Caucasian, Hispanic, Indian, and African American. HCPs were a mix of male and female caregivers, and they had to have technology or access to technology, including Android, iPhone, computer, or iPad. The pie chart presented in this slide shows that 86% of the participants were female and 14% were male. Data analysis was completed to evaluate post-MCSI scores to determine if those individuals who had a score of 4 or more, if mindfulness interventions were effective at reducing that stress. I collaborated with a Maryville University approved statistician, Mark Fowles, to perform a 1 proportion z-test. There was no independent variable for this project. The dependent variable was used to show if HCP caregivers experiencing increased stress were taking out of that anxiety level by lowering their MCSI tool scores after mindfulness resources, making this a yes or no question. This data is considered nominal. A sample size goal to run this specific statistical test was at least 18 participants. As for the results, there was no significant difference between pre and post mindfulness resources in this DMP project. A 1 proportion z-test showed z equals -4.6 with a p-value of 1 that is not significant. The result of this analysis determined that the p-value of 1 is greater than the significance level of 0.5. The pie chart on this slide represents the compliance for the project, which was compliance 5% and non-compliance 95%. There were various limitations in this DMP project. There was a total of 26 interested participants, but only 21 met inclusion criteria. As mentioned above, there were 86% female and 14% male. Due to the small sample size and 86 participants being female, it may be hard to generalize these findings to a larger population. Another limitation in the study was the time frame of 8 weeks to complete mindfulness practices. This may not have been enough time to gain the full benefits of using mindfulness practices. Also, HCP caregiver stress was not measured at baseline at the project site, so we do not know the participants' stress level at the start of their caregiver role. This project also included the limitation of communication. The HCP caregivers at the project site work across 15 different counties, so using an email communication system resulted in low response rates, especially among HCPs who may have had a busy caseload, maybe overlooked the email, or deprioritized the project. In addition, without that face-to-face engagement, it was difficult to build rapport, foster motivation, and address any resistance to change. This is as evidenced by having to send out multiple emails to gain participants for this DNP project. Another limitation that is unknown how many participants may not have had access to technology to perform the mindfulness practices given the clinical setting. Another limitation would be the individual differences. It's hard to tell their level of engagement with the mindfulness practices across all participants. In this DMP project, there's also the possibility of psychological risks. as participants had to think and rate their stress levels. This may cause an emotional distress reaction. To minimize this risk, if participants did have this response, a list of behavioral resources were readily available by me, the private investigator. Another thing to take into consideration is that this is a Western adaptation of mindfulness practices. It does not recognize cultures that use other methods of mindfulness, which may lead to some criticism. I also wanted to take a moment in this section to make it clear that this is not a standalone treatment. It does not replace therapy, such as cognitive behavioral therapy. It is used as a complement to reduce stress levels and actually works best with therapy. So I wanted to put that in this slide to make sure everyone was aware of that. So stress among HCP caregivers in the home setting is a growing problem. More attention should be focused on recognizing and reducing this stress. Healthcare caregiver stress is a critical issue and can directly impact patient safety and quality of care, as well as impact the workforce within the healthcare organization. Utilizing mindfulness resources over 8 weeks did not show significant results in reducing HCP caregiver stress. However, based on the findings from this project, there is evidence-based research that utilizing mindfulness resources or practices is an effective strategy to reduce stress, promote emotional resilience, and improve job satisfaction. The next step would be to prioritize the implementation of integrating the MCSI tool and mindfulness activities into daily practice. Leadership should provide support to HCPs with well-being initiatives, as well as providing a culture and increased awareness within the organization that values mental health. As for implications for practice, the findings of this DMP project can impact practice by demonstrating the increased stress levels of HCP caregivers and improving caregiver stress, reducing mental, physical, emotional risks that impact the care they give to their patients. The findings can impact health policy at the project site by including more screening and resources for HCP stress. The caregiver should be screened for stress with the MCSI tool at the start of employment. This will obtain a baseline. Then, if it is added into employee reviews, you will be able to determine how the job is impacting the caregiver and their stress levels. Current practices prioritize patient safety and quality metrics but lack awareness for HCP well-being. Healthcare policy development should focus on creating supportive structures to recognize HCP stress and burnout almost as an occupational health hazard, similar to how we recognize workplace injuries. A change in the healthcare policies should be to develop and focus on implementing mandatory wellness initiatives, safe staffing ratios, mental health resources, protected time for mindfulness activities, and peer support interactions, which can reduce the feeling of isolation. This DMP project can help advocate for policy changes that addresses HCP stress through evidence-based practice at a local, state, and national level. The recommended healthcare policy change could help protect future HCP's mental health to reduce caregiver stress and improve patient care. It is also important to consider our current political environment leading changes in healthcare that can result in HCPs moving into new roles. So it is essential that now we advocate recognizing HCP stress being real to help prevent long-term health outcomes, harmful health outcomes. In conclusion, mindfulness practices can increase HCP caregiver focus, resilience, clinical judgment, and decision-making skills. HCP burnout in a caregiver role can lead to poor patient satisfaction, miscommunication, and increased risk for medication errors. Effectively managing stress can mitigate job burnout, reduce absenteeism, stabilize the workforce capacity, and provide a continuity of care for the patient. Mindfulness practices also enhance the fulfillment of cultivating a more positive organizational culture, which attracts and retains healthcare workers in the home care setting. This project is crucial for developing strategies to mitigate HCP burnout, foster a healthy, more productive work environment. This can in turn give the highest quality of care that is well deserved by these patients. As for future considerations, future improvements could be including measuring stress at baseline and at employee reviews, and also providing engagement of physical activity in the community. This can enhance social connection and help reduce social isolation and improve self-esteem. A goal for sustainability for the project is promote lasting change that supports HCPs by improving resilience so that patients receive the optimal level of care. Reducing burnout also benefits the organization by promoting a continuity of care and having consistent caregivers for their patients. I personally have learned mindfulness practices promote awareness, emotional regulation, cognitive clarity, and are crucial to managing high demands and emotional intensity in the HCP environmental setting. I personally work in this field and recognize how much stress caregivers experience. Without resources in place, it is important now to have recognition of caregiver burnout and resources available. Mindfulness is a strategy that supports the development of coping skills to increase resilience. It is a key for growth in clinical judgment. Routinely incorporating mindfulness interventions can provide a lifetime of responsive methods in nursing to manage stress throughout the HCP's career. I provided all references used in this PowerPoint presentation. And lastly, I would just like to thank you so much for listening and have a great rest of your day. Thank you so much.